For more on the Labor Party's proposed $1 billion investment into mental health, Jason Trethowan, CEO of Headspace, the National Youth Mental Health Foundation, joins me now in the studio. Jason, welcome. And what's your reaction to this announcement?
Really positive reaction. It's a strengthening of what we already have, and there's also going to be a build on what we don't have, and that is more services for those young people with increasing complex needs. So overall, pretty good package.
And so if you can break it down for us, what this announcement means for Headspace as to where it is now and where it would be if the government's re-elected and this comes to pass.
Yeah, what we wanted to see was the Headspace, which is for 12 to 25-year-olds, mainly around the areas of mental health. But what we'll see is about 58 Headspace centres strengthened, including in that number would be a few extra Headspace centres, a few upgraded sites, but also more importantly actually boosting the capacity of existing sites, particularly in those areas of metropolitan and large regional centres where there's huge numbers of young people.
And Headspace, not the only service to benefit from this. How do you understand that other money will be spent? Because they all complement each other.
They sure do. So half the package is actually going to an additional 20 new hubs, which is something that we haven't got here in Australia, but it's a building on the success of early psychosis programs that are actually been part of Headspace in about 14 different areas. So what that will mean is that more those young people with psychosis, eating disorders, schizophrenia, other serious mental illnesses where they'll be backed up by greater expertise of which GPs and Headspace can refer into.
And just tell us with Headspace, I mean, you outlined the ages there, 12 to 25, but who exactly are they targeting at that mental health challenges that they're facing?
Yeah, look, 50% of the, or 75% of the issues emerge before the age of 25 when it comes to mental health. There's been a rise in prevalence of mental health issues. Anxiety and depression are the two main presenting issues. So we're looking at, particularly for those young people at the earlier age, we're getting a lot more 12 to 14-year-olds that transitioning from primary into secondary school. And we still have lots of school-age young people, and those who are transitioning out of school into the unknown world of work and study. A lot of uncertainty for young people, but I've got to say young people are incredible, they're resilient, but occasionally they do need some supports, and this extra boost today in this commitment will go a long way for that.
I just have to ask about that heckler that we just saw there at the news conference this morning. You know, she was saying that the use of fossil fuels is a major contributor to mental health. Do you agree? Is that what you see?
Oh, look, young people always talk about climate change and they talk about uncertainty in relation to the future. They care deeply about the planet. And so, yeah, look, that was quite a distressing moment in the conference this morning. But, yeah, we often hear around young people's mental health and wellbeing are impacted by climate change, and that's been well documented and well evidenced. So, yeah, I guess that was an awkward moment this morning, but certainly something we do hear of.
With that boost that's been announced, what would that mean in terms of getting more people, or their mental health issues identified early, and why is that important?
Well, getting on top of things early is what early intervention services like Headspace is all about. We don't want people presenting to emergency departments in high levels of distress or crisis. So what it means is that we'll be able to increase our reach into communities, more work with schools, reducing stigma. Stigma is still too big. We're good at talking about mental health, but when it comes to help seeking and going into services, there's still a big challenge there. So we'll do more in that space, reduce wait times, increase the capacity for more clinical staff, but also those who work in the areas of work and study to help young people into employment where mental illness is a barrier as well. So hopefully see more GPs working at Headspace. We know that's been not enough, and we're looking forward to seeing that as an opportunity. So more comprehensive services for young people and greater presence in the Australian community.
And the Prime Minister said there's more to come on mental health. What would you like to see from either leader in this election campaign or beyond? What do you think needs to be done in this space as a matter of urgency?
Oh, look, it's all about implementation. I mean, these are moments about announcements, and then it comes down to implementation. Certainly growing the workforce is a key part of what we all need to see. We can't just pluck clinicians out of the air. So it's going to be a progressive thing. It won't happen all overnight, but we're really confident that with these types of announcements, that we will see staff wanting to come back and work at Headspace because there'll be more funding to be able to employ people in jobs. It's a free service. So it's actually really important because cost has always been and is still a barrier to young people seeking support. So we're looking forward to increasing our service availability for young people.
Jason Trethowan, CEO of Headspace, thank you for coming in.
Thanks a lot, Gemma.